Welcome to Performance Perspectives, Performance Development Group's podcast for commercial leaders in life sciences. Each episode features industry experts tackling the sector's biggest challenges, offering actionable insights to drive performance and boost marketplace impact.
Today, we're taking a look at the Inflation Reduction Act, an event that is poised to reshape the landscape of Medicare drug pricing and trigger a cascade of massive changes across the entire pharmaceutical market in the United States. To help us unpack this topic is Chuck Collins, a true authority on managed markets and healthcare policy. Chuck's been guiding organizations through the maze of healthcare legislation for over 30 years. Hi everyone, and welcome back to Performance Perspectives, where we tackle the big issues on the minds of life science commercial leaders. I'm Dan Snyder from the Performance Development Group, or PDG for short. For those of you just joining us, PDG is a specialty consulting firm for life science companies that's focused on driving performance improvements, accountability, and behavior change in client-facing teams. Today, we're going to dive back into part 2 of our exploration of the Inflation Reduction Act, focusing on its impact on pharmaceutical client-facing teams. Once again, I'm happy to have Chuck Collins with us today, and Chuck's going to help us go through and help us navigate the complexities of this legislation. Chuck's a principal in managed markets consulting with over 30 years of experience in the pharmaceutical industry. And Chuck, for viewers that weren't with us the first time, could you elaborate just a little bit on your background for the audience?
Sure. Chuck Collins. I am president of Healthcare Stakeholder Solutions. We are a market access consultancy focused on disparities in healthcare delivery. By way of background, I would say over 20 some odd years in the pharma industry itself and 2 different manufacturer companies, as well as been in the industry for over 35 years.
Yeah, it's great having you back, Chuck, so thank you very much. Chuck, when we spoke last in part 1 of this series, we talked about the key provisions of the Inflation Reduction Act and its broad impact on the pharmaceutical industry. Today, I'd like us to focus on how it might affect day-to-day operations. So,
Sure.
How do you see the Inflation Reduction Act becoming a strategic priority for pharmaceutical companies, particularly in their commercial operations?
Yeah, so I think, great question all the way around. I don't know how it could not be a strategic priority. It's going to impact, everyone. And I say everyone, I mean not only the pharma manufacturers, but the health plans that are involved, the payer side, if you will, in particular. So as we look at the payers and the pharmaceutical, organizations, like they have to work together. And one of the biggest things that has happened with the Inflation Reduction Act is, when you peel the onion back, you're really looking at, this is probably a major pricing impact, law that is taking place for the very first time in the Medicare space. So when you look at the organizations, you have to start thinking about pricing has now been dictated in how it's going to be constructed in the framework that we're looking at, but also start looking at what you thought you had great access and reimbursement, the access and reimbursement models across, the not only Medicare, but also the commercial side are going to be impacted by this. So I think major access and reimbursement strategies are going to be impacted by this completely.
Yeah, that makes a lot of sense. I wanted to really carve off and start to think about these companies, the pharmaceutical companies that we work with, and their field-facing teams, whether it's sales or anybody else along there, but we'll probably focus primarily on sales. What challenges might they face when they're engaging with healthcare professionals, their customers, about products affected by the IRA? How might this change, over time as the IRA continues to grow?
Yeah, so I think 2 things happen here. So again, when you think about the Medicare beneficiary, they're going to be capped at $2,000 and go in 2025 and beyond, right? So I think some of the challenges that they've had in the past, where whatever the therapeutic area, whatever their brand drug that they're in, they're talking to their customers, right? The ultimate question that comes not only from the healthcare provider but also the staff is, will my patient be able to afford your medicine? How can you help them? And again, the IRA is really super focused just on the Medicare beneficiary. So we have to kind of stay in that lane, if you will. So for the very first time, you get to say they're capped. And because of the cost of our drug, they will be through the benefit design fairly quickly. And we as a manufacturer, and I think this is an opportunity for pharma manufacturers to actually talk about the value add, if you will, back into the community, because they are subsidizing not only the initial coverage phase, but also the catastrophic phase. So they're giving discounts back to CMS, which ultimately has lowered, the cost of drugs for the beneficiary. So I think they need to start communicating those things, into these offices and showing that they're a partner, right? We're here to make this a seamless process for their patients as they embark on using their drug, right? That transaction's taken place where the healthcare provider has made the decision with that Medicare beneficiary that this is the appropriate drug at the right time. So now it is making sure this is a seamless process. So I think you've got those, field-facing teams that are in there that they're going to be able to the first time saying, when it comes to a Medicare beneficiary that's using our product, their costs are capped, and we're here to support that, and we are supporting it obviously through this benefit design. But being able to overcome that cost challenge that normally takes place. They don't have to, they can still go seek the charitable organizations, but the field-facing teams will now have, I think, a better conversation, in these offices based on, the pricing constraints that have been put on through the IRA.
It seems to me like maybe one of the strategies might be to, work with your customer-facing teams, that when they're engaging with their customers, to encourage the offices to be proactive about making sure that their Medicare patients are enrolled in this. Does that make sense, or does that seem like a logical strategy?
So when you're talking about the enrollment, so they're already going to be in a benefit design, the Medicare Part D benefit design, but you might be speaking of the Medicare prescription payment plan. Far as being able to, if they can't afford their $2,000 costs, being able to spread those payments over time. That is something also that I've seen clients do, where their field reimbursement teams and or their sales teams are actually having those conversations to let the offices know that, for their product and other products, that there is a new payment option that, the Medicare beneficiary can sign up for. And they play a valuable role in being able to bring that information in, because I can tell you right now, everything that's going on in the space with the Part D redesign and this new payment plan, offices, pharmacies, there's more questions than there are answers. And so anywhere that a pharma manufacturer and their field-facing teams can be that partner and be that entity to provide solutions and help answer questions of everything that's going on in the space, I think they're going to be better off, and they can differentiate themselves from their competition.
Yeah, that's great advice, and it's similar to what we're seeing with our clients right now. And I got to imagine that, some of it is just beginning, right? So the momentum is beginning because we're getting closer and closer to January. I would think, though, that first quarter of next year is when it will hit fever pitch, where offices, pharmacies, all the things that you talked about are going to have a ton of questions. And so preparation for how you're going to handle that in Q1, to me, seems like one of the most critical success factors heading into 2025. Do you think that's the right thinking here?
Yeah, I do, because I'm gonna do the flip side. I think it would be a major failure for pharma manufacturers not to have their teams trained, educated, and ready to go to be that resource for those offices, because questions are going to come up, and the worst thing you want to do is say, I don't know, or I don't know what you're talking about. They may have to talk to their health plan to learn more, which they do, but you don't want that to be your message. You want to no, we understand what's happening with the Inflation Reduction Act. Here's what we can do to assist this office. Here's information that they may want to further go on to a CMS website to learn more.
Yeah.
But we're here to be your partner and walk through this and make sure that you're very aware of everything that's taking place, because things will change, right? They will change over time.
One of the other customer-facing teams that we work with quite a bit are the medical science liaisons and the medical value liaisons. They have obviously a different focus when they're out interacting with healthcare professionals, but how might their roles evolve in light of the IRA's implementation?
So I think it's going to be more indirect than direct, only because we're talking about pricing more than anything. With the IRA and the impact of, looking at the cost of the drug, things that normally MSLs don't talk about and medical department, personnel don't really talk about. But I think there's still a grand opportunity given all of this, because I think where the downward pressures are going to be is going to be on the clinical story, is going to be on the clinical value of that, particular brand in that therapeutic area and that unmet need. So I think what will happen is there's going to be more attention to what's going to differentiate from a clinical perspective, entities as we go into 25, 26, 27 with the impact of the Inflation Reduction Act.
Yeah, so what we're starting to see, Chuck, just so you know, is that some of these bigger companies are creating a position that they either refer to as sort of like a medical value liaison. They're charged with exactly what you were just describing here. They are going to get into the health economics and the outcomes, that value and the value across the board. So it seems like the companies are at least adapting on that side of the equation or the firewall.
Well, I think that's going to be really critical, to continue this thread here for a second, because again, payers are going to start narrowing networks. They're going to start looking for reasons. They have 7 JAK inhibitors out there as an example. They don't need 7, right? By law, they have to carry 2 per MOA, or mechanism of action, on the Medicare side. And we're talking about Medicare. So you want to make sure you're one of those 2, right? And then they'll negotiate, the best pricing they can get through the manufacturer. But to do that and have a little bit of a lever from the manufacturer side is, I've got the right value story. I've got the right budget impact model and health economic story that solidifies and actually differentiates me from anybody else.
Do you anticipate that pharmaceutical companies should take a more proactive stance or reactive stance when they're discussing with the IRA? I think I know which way you're going to go here, but regardless of your advice, talk us through a little bit of the pros and cons of each approach.
Yeah, so I think, yes, I'm always going to say proactive, right? Proactive is where I think one would be, is again, you don't want to be caught short. Whatever your field-facing role might be, that you're not aware of what's going on, especially with the Inflation Reduction Act. And, it is centered on our elderly population, and being able to understand the nuances of what is taking place and what this benefit design looks like and how that's impacting, your customers. Because again, your customers are going to have questions, and you can either be seen as a valuable resource or not. And I think you want to be seen as that valuable resource, right? And I think being reactive, really puts you in a tough spot, because, when we talk about, being in that office, whether it be the HCP, the reimbursement manager, any physician assistant, doesn't matter. They have a question, and you're in the office representing your organization. No matter what the question is, it could be something that may not be something you can actually answer because of your role, but they're going to ask you. They're not going to. What they don't want to do is, I'm going to triage this over, and this person's going to come in and see you, kind of thing. Versus, I will take this and get it to the right person. The right person will contact you back and get your information. And what I mean by that, as an example, is, if you're in the office and a HCP asks a clinical question and you're a field reimbursement manager, well, you really can't answer that question because that's not your wheelhouse. However, you'll get it to the right information. You'll be able to follow up through that and make sure that it happens, right? Because they're not going to sit there and wait for the right person to come in the door at whatever time. So you want to make sure that you're having those active communications and being able to provide, that kind of level of service that they're looking for in that office.
I'm going to nuance what you just said a little bit, and I want to get your reaction to it, if that's okay. So when we take a look at the landscape, I think advice, if someone were asking me, is I would say, well, you better be very proactive in making sure that you ramp up your customer-facing teams so that they're comfortable and confident around this entire topic. So regardless of what they do and where they are in the engagement of healthcare professionals, you better raise their competence and confidence so that they feel like they could be the value add that you were talking about. Some strategies may have you being very proactive. What I would caution our clients on is having to be too proactive with the healthcare professional or the doctor. Because there's plenty of evidence that shows that doctors at the end of the day are interested, but they don't want to get into real detailed conversations about reimbursement about their patients. That's why they have an office manager. That's why they have reimbursement people within their offices. And so I could see customer-facing people, especially salespeople, going down a rabbit hole and not getting to the benefits of their product from a clinical perspective. So how do you position this effectively so that you quell any questions or hesitations that a doctor might have, but quickly get to the people in the office that are going to be dealing with this on a day-to-day basis? And then the other side of it is, if you happen to come in and get hit with it right away, from anybody in the office, including the doctor, you better have a good reaction that is going to accomplish the exact same thing. So when I say it that way, Chuck, what are your thoughts?
Yeah, and I think it's duly noted what you're saying about too much information to the HCP kind of thing. And so when I think about customer facing, I do think of, I don't want to call it the total office call, but I am thinking of the entire office when you're in there, because you're not normally there just to see one person, right? And so I think it depends on who you're talking to, but there's a couple ways to do this. I think it's important to let the HCP know that you're going to talk to the office staff and make sure that we can set up time. Maybe it's a lunch and learn that you come in and do, and let's talk about the Inflation Reduction Act and how it's impacting you and your patients, right? Your Medicare patients. And I've worked with companies where they've created customer facing presentations more from the field reimbursement side, but to come in and say, here's what's going on, here's how it's going to impact your patients. And in so much that I've had, some pharma clients that will actually put brochures together to learn a bit more information. It's like, here's something for your patients. So if they have other questions, here are other links and numbers that they can call to find out more information, so that people are not blindsided by all of this, right? And I think that's a key piece to this as well. In this case, more information is probably better than less, because there's so much confusion out there right now, everything that's going on in this space, and it's happening very quickly. And part of that is we did not get the CMS final rule guidance, part 2, until July. And after July, like the middle of July, so after July, everything went into overtime mode, if you will, across the board. Health plans having to be able to create materials and get things printed, to everybody understanding what the final impact is going to be with the guidance that just came out. So the government was a little slow in releasing that final guidance, but nobody could do anything until it came out. So we hadn't actually understood some of the operational pieces of how this is going to happen.
But I want to get back to what I was talking about here, because I think there's a balance. And again, I want to get your reaction to this, Chuck.
Sure.
Is that if you go in with the primary purpose of educating what the IRA is, you may lose an opportunity to talk about the efficacy and the clinical benefits of your product as well. So I think there's a balance that you have to strike, and your point was well said about making sure that in the office that you're tailoring that message to the appropriate person. So someone that deals with, reimbursement and dealing with the patient and all these questions about plans and whether your product is on that plan, that's a different type of conversation where there might be a heavier focus on the Inflation Reduction Act and educating and helping those folks think through this appropriately. But for the doctors, there has to be a balance here, because it's easy to go down that rabbit hole and we don't get access like we used to. So I'm hoping that makes sense for our audience, that balance is really something that you have to strive for with your customer facing and, more importantly, your sales teams. What are your thoughts on that?
Yeah, I think first and foremost, I think the priority will always be, especially for the field-facing teams, the sales representatives that are in there with the HCP, is always going to be talking about your features, advantages, and benefits of your product, the clinical story that's there, because that's really where it all begins. That's the foundation. If you don't have a good clinical story, or if that clinical story has not resonated yet with that particular HCP, then everything else is mute, right? Nothing moves forward. So everything has to be done on the science. The clinical story has to be there. And then the question might come up from the physician and or the office of what's the affordability of this particular, pharmacotherapy of this product, right? So I think it has to be in that order for sure.
Yeah, no, I appreciate that perspective. I think you started to go down this road a little bit, Chuck, and I want to dig into this again and see if there's other thoughts that you might have. What kind of training and coaching or resources do you think customer-facing teams will need to address the Inflation Reduction Act? Whether it's related questions or the sharing of information or even concerns from the offices that they call on.
Yeah, so I think when we start talking about education and really training and learning and development in this area of the IRA, I think what's important for customer-facing teams is they have to see the broad stroke, like what's the overall goal of the Inflation Reduction Act, and then really very quickly getting to what's the so what for me, like how does the Inflation Reduction Act actually impact me on a day-to-day basis in my role and what I do, right? And then you can clearly see that in the offices, right? Not only to the HCPs, but the office staff and the actual Medicare patient population that they take care of. So where you're going to see more questions and where the training is really going to be important are those offices that are heavily Medicare, right? If you have a product that's mostly commercial, then you probably don't have to spend as much time currently on the IRA. But if you have a product portfolio that does touch the Medicare population and, a big percentage of the Medicare population, this is definitely something that you should be looking at from a training perspective.
Yeah, that makes a lot of sense. I think what we're seeing is that balance that I was referencing a little earlier is how do you make sure that this doesn't become the entire opportunity when you get in front of customers, that there's this balance around how do you get into the IRA when it's appropriate, but how do you continue to talk about the clinical aspects of your product so that you're encouraging that first step, which is the reason to want to write a prescription. And so that training is going to be how to balance those conversations, how to maneuver in and out when it's appropriate. And I think the coaching then is how do I continue to help develop my people so that they're becoming much more confident and efficient and proficient in front of their customers. So I don't know, again, if there's much other that you could do at this point in time, because some of it, as we said in episode 1, is sort of speculative. So they're probably going to have to adjust a little bit of their training and resources as they learn more and move into 2025 and into 2026. But I think we both could agree that there has to be balance and that these companies should be very proactive with their customer-facing teams.
Yeah, no, absolutely. And I think you made me think of something as you just said all that, Dan, and that is, so market access in general, right? Managed markets, market access, managed care, just the training on that alone is an area that, it changes all the time. So I think for organizations, they have to make sure that their teams have that foundational knowledge, right? To feel comfortable and get that confidence to be able to have these conversations. Because if you don't really understand Medicare, it's really hard to go in and talk about the Inflation Reduction Act, right? If you don't understand how the benefit designs are structured and what it means at the end of the day and what's covered and what's not covered and how things are reimbursed, that's a different set of issues right off the bat. Nothing to do with the IRA, has everything to do with, how well are your teams trained in market access? Do they have that foundational knowledge? Do they feel confident to have those kind of conversations? Because typically what also goes around with cost in these offices is going to be is is it covered? Is it reimbursed? So especially if you're in a buy and bill situation, right? That's going to be a big question that's going to happen in the offices themselves, talking to those reimbursement managers. But even with specialty pharmacy as well, is understanding where something is. And then we start talking about utilization management strategies like prior authorizations. That is an area where field teams don't feel as comfortable when there's a prior auth involved. And then understanding who to triage that to and, be able to have those kind of conversations to make sure it can get resolved. A lot of times it turns out that prior authorizations or something's denied is because somebody didn't fill out the right paperwork. Not all the boxes were checked or not everything was signed appropriately. So it could be as simple as that. And you don't want that to be the rate limiting step of the patient not getting your pharmacotherapy.
Yeah, I think you touched on something very important, Chuck, and that is if we think about the rep of the future and how these companies have to evolve the way that their customer-facing folks are in the marketplace and how they're being perceived by their customers, there's an over-index, and has been appropriately for many, many years, about being, clinical experts, right? And having that clinical acumen and being able to talk on a high level of clinical knowledge when you're talking with your customers. It seems like there's going to be an increase in value in being able to talk about the business side of things, which is access and how the patients get it. And the IRA right now is more or less that lever that is driving some of this ramp up, but it's not the only piece of access for the patient. So being comprehensive experts is an important part. This just happens to be, the primary thing that people are going to be thinking about and talking about in the moment. But that doesn't mean that everything else sort of falls by the wayside. Would you?
No, that's a great point, Dan, all the way around, because that is exactly what's happening. And I never thought of it that way, but the IRA actually is creating that business acumen need more than anything. Is like, this is happening. We've got a benefit redesign here, and we have a new payment option. And, even though pharma's not directly involved with that payment option, being able to answer those questions or help an office understand, how these calculations come about a little bit, takes some of that anxiety out of the air, if you will. And you want to be seen as somebody who can be a value add partner, right? You want to be that resource in those offices.
Last question for you today. So if you're looking ahead, Chuck, and your expertise and the clients that you work with and all the questions that you get asked, how do you see the relationship between pharmaceutical companies and healthcare providers evolving as a result of the Inflation Reduction Act?
So I think what you're going to see are the narrowing networks that are going to be taking place. Access and reimbursement of products is going to be, under the microscope more and more. So the manufacturer and the HCPs, I think that relationship is going to get stronger because price is not going to be the issue so much, and the affordability is not going to be the issue anymore. But it is going to be more of understanding the access and the reimbursement piece to this with the healthcare providers.
I appreciate that, Chuck. Well, I think that's all the time that we have for today, and it's evident to me that there are some significant implications how client-facing teams will operate in the future and have to communicate moving forward. Chuck, I really want to thank you for your time, both in the previous segment and today, for sharing your expertise and insights. I, for one, found it very valuable.
No, again, thank you.
For our viewers, if you found this information valuable, please subscribe to our channel and click the notification bell to stay updated on future episodes. In the description, you'll find a link to learn more about how Performance Development Group can help your organization prepare for this and other significant industry changes.